Hi, my name is Andrew Campbell, and I'm the founder and CEO of Campbell Research and Consulting, based out of Indianapolis, Indiana. My passion is reaching as many as I possibly can with my message regarding family violence, and I appreciate the opportunity to speak with you today. Not really my how I usually share my message. Last year I spoke 41 times in person at conferences and trainings around the country in over 20 different states. And this year has looked a little different. I focused a little more on my writing, working on publications and advancing my research, and then I'm also providing webinars and talks electronically as we're doing today. Today we're going to be talking about family violence and specifically how our response to COVID-19 is impacting family violence, both incidents and reports or lack thereof. As I said, I'm the CEO and founder of Campbell Research and Consulting, where I focus on the overlap of different forms of family violence, focusing in particular on child abuse, domestic violence, and pet abuse. You can see my dogs Charlie and Mia there, extremely proud of themselves after finding the mud pit in our backyard the day after it rained. I'm often asked why domestic violence, why do I focus on these particular issues, and I won't get too far into this today, just for sake of time. In a lot of my talks I speak for 2 or 3 hours, but today I'm going to keep this closer to 60 minutes, so we won't get too far into this, but I do have a lot of personal interest from my own personal experience. I have my own observable brain changes related to toxic stress exposure from youth and early adulthood of just pretty intense emotional harm. Again, as I said, we won't get too much into that today, but I do want to add that this dog right here, Shelby, is really what got me through. I credit him for saving my life. I don't know where I'd be today if it weren't for him, but I wouldn't be here. I do know that. As I got older than you see there in this picture, I would have thoughts of just wanting to end it all, just wanting life to be over. I just got to the point where I was just so stressed. I was having stomach aches, headaches constantly from all the stress exposure. I just wanted it to be over. But I remember that dog, and his impact on me really cannot be described in words. His unconditional love and support for me is literally what held me together and got me through. So I try to honor him with my talks, and I often do talk about pets as we will today. My professional experience working with many different agencies such as law enforcement, child welfare, animal welfare, medical providers, just seeing domestic violence from many different angles. So when you combine the two, my professional experience and my personal experience, you kind of get this unique perspective that I have on violence occurring in the home. And again, I cannot be adequately described the impact that dog had on me and still does to this day. When we think about domestic violence prevalence in the United States, even before everything that we're seeing now, it seemed to be a little confusing. Depending on which source you look at or which report you read, it often felt like we really had no clue what was happening. Some resources say that domestic violence is declining, others say it's skyrocketing, others say it remains the same. I think some of the information I hear most commonly trusted or that we often hear is the idea that, and it's staggering to think about, that 1 in 3 women and 1 in 4 men in the United States at some point in their lifetime will experience physical violence at the hands of an intimate partner. Again, just staggering to think about. And that doesn't even take into account emotional abuse. So when we add that in, there's some estimates that 50 to 80% of relationships in the U.S. Will turn, at least in some manner, emotionally abusive at some point. So again, we're talking about something that affects such a large portion of the population, even before everything that we're seeing now kind of exasperated and furthered the risk and increased the violence and severity. I often refer to domestic violence as a silent pandemic. It was here long before COVID-19. For whatever reason, it doesn't ever seem to get the interest and attention it deserves, especially when you consider how much of the population is impacted. Other ways to look at DV prevalence. We know it affects at least 30 to 40% of families involved in the child welfare system. Depending on where you are in the country, as many as 50% of your police department's calls may be attributable or related in some way to a domestic or some sort of domestic disturbance. And up to 35% of all hospital ER visits are attributable in some way to domestic violence. It's also important to note that in some, or maybe even many cases, adults may not be able to seek care for themselves, but may be allowed by the perpetrator to bring in children for care. So if you're a medical provider and you work with children, also important to remember to be aware of adults in the room and the caregivers that come with the children, as there might be opportunity to detect violence there, even if obviously the adult's not allowed or able to seek care for themselves. Many of the things that we'll be discussing today are also found in this article I published. We're in June. It's hard to even, all the days feel like they run together. It's hard to keep track of time. But so I guess we're a couple months ago now, there in early April, that I published. At that point, I was concerned that we were going to see family violence and the risk go, unfortunately, in the exact direction that it did go. So I wrote that article really at the end of March, early April. And now I'm going to be speaking from it as we've seen it come to pass, unfortunately. So if you have access to that article, I think I shared it, or if you did not receive it, email me. I'll provide my contact information at the end, and I would be glad to send it. It's open access, so you can also just go to the website or search that yourself and download it for free. Here's a list of some of the things I talk about in that article and that we'll hit on a little bit throughout the day. Again, or throughout this webinar. Again, we know that the response and action to this virus was necessary to slow it. The unfortunate thing is that the impact of those actions to slow COVID-19 have seemed to accelerate family violence. When we think about closing organizations that are so critical to families, to their routines, obviously they're going to be impacted. We see children being much more likely to be in the home as a result, and potentially being cared for by adults who don't normally care for them. When bars and restaurants closed, I was extremely concerned, because I know in the literature it's pretty clear that many domestic violence perpetrators, and particularly those that are the highest risk, abuse alcohol. And often have mental illness as well. But if they have nowhere to drink in public, essentially now they're going to still be drinking likely, but where are they going to be doing it? They're going to be doing it in the home. So you're looking at children being much more likely to be in the home, and perpetrators being much more likely, if they were employed, to not be at work, to be in the home, not at a bar, drinking at home. Social distancing, unfortunately, is something that we often see these perpetrators employing, and our actions, again, necessary to slow the spread of the virus, have likely exacerbated this among domestic violence victims. We know many stress and risk factors or much stress and great stress, and many risk factors are present right now, and we know that there's clear risk there, for perpetration of abuse in the home, and really those risks are off the chart right now. The idea of self-quarantine, again, necessary to slow the spread of the virus, but really just plays right into the hands of an abusive partner, and of a domestic violence or family violence perpetrator. Victims often have to wait until the abuser leaves to call 911. And if you're trapped with your abuser, when are you going to be able to do that? We do see or have seen communities across the country reporting that calls to their local DV shelter jumped right before mandatory lockdown occurred. Probably people knowing they had limited time, they had to get out. They had to get out of that home before they were trapped there. Eerily, then the calls just dropped off for many communities right when lockdown started. And again, thinking that it could be because these victims are trapped and unable to call. And then now, as some communities have kind of are moving through phases and essentially trying to return to normal, whatever that looks like or whatever it will look like after all this, whenever that is, they are starting to see their calls come back up. So just the important reminder, hopefully we don't have to deal with this again, but it seems pretty likely we will. When we do these types of mandatory lockdowns, I do think it's necessary and important that we are making a clear message to our community that if your life is at risk in locking down, that we don't want you to lock down and that spike your risk of being killed by an abusive partner. We have to make sure those channels are still open, and that it's clear that if there is that risk, we want to do something to protect you before you are in a situation. Now, will they always know that risk is there? No. I mean, we know that we saw a rise in first-time offenses during lockdowns as well. But unfortunately, for those where there was a history of abuse, it seemed to accelerate and become quite severe very quickly during lockdown. So again, it's important to remember victims have to be able to call us in order for us to be able to help them if we can't get to them. When we think of risk factors for abuse, obviously we know abuse can occur in any home, that it can occur in homes where there's high levels of income, where the perpetrator is employed, where they have high levels of education. It doesn't mean it can't happen there. It happens everywhere. But these are just some of the common things that come up in research and literature that we see among perpetrators. You'll see I've added all these circles on the sides there too. Just everything going on right now related to COVID-19 has really spiked these risks. We think of houses being just full, with people spending a lot of time together that they're maybe not used to spending that much time. Our opportunity to detect violence and therefore accountability has been limited right now. Many of these families have limited resources. Bars are closed again, so drinking occurring more likely in the home. Gun sales have hit record numbers, so we know that guns are a high risk factor for particularly domestic violence homicides. They're much more likely to be in the home. These overall feelings of just not having any control of what's going on. And then when you add in a history of being victimized, and then drugs, alcohol, things like that, again, we are just seeing risk at an extreme high during this pandemic, and we'll probably see it after as well. And who often pays the price, right? And we know that adults, children, and animals in the home often obviously are extremely vulnerable in these types of scenarios. I do want to add that obviously we do see female perpetrators of domestic violence and male victims. I do want to note that. I think it's important to acknowledge that. When we add in the piece of animal abuse, it's overwhelmingly more often a male perpetrator and a female victim. So that's usually why I refer to them as such. But I do want to acknowledge that we do know that domestic violence occurs in all relationships, whether it again be a male perpetrator, female perpetrator, or whether it be a same-sex relationship. We see it occurring across the board in all types of relationships. Haven't really made many changes to this slide that I actually created, I think, in March or April, because essentially every other country that's come out to describe the impact on domestic violence or family violence in their country has said pretty much the same thing, which is a pretty dramatic increase in incidents. And here in America, we did see a drop in reports pretty soon after mandatory lockdown orders were issued, and then we saw them start to come back up as some of those lockdowns became voluntary. But overall, it appears that we're somewhere, and again, this is just looking at media reports and reports from communities and other studies, looking at around 30 to 40% increase in the U.S. as well. So it kind of matches up with some of those other countries. Again, likely just a tip of the iceberg. We know there are so many barriers for victims to report, and this is only based on cases that are reported, which may only represent 1 in every 4. So again, we are looking at 30 to 40% increase in reports is significant, but the incidence that indicates is even greater, and obviously a real cause for concern. An important point I want to make that's based on one of my prior studies, and any of the studies I referenced today that you have interest in, please email me if they're my own, and I would be glad to send them to you, no problem. But one of the things I looked at when I looked at a study a few years ago, I utilized police reports to look at seasonality of intimate partner violence. And I found that intimate partner violence was most commonly reported to law enforcement in Indianapolis, Indiana, where I reside and where I'm from, on Sunday. Which I thought obviously was interesting. It kind of surprised me. It wasn't necessarily what I had expected. When I started looking at other communities, here's another Indiana community, and then here's 3 other states that I looked at in Cedar Rapids, Michigan, Virginia, and in Oklahoma. Starting to see the same trend occur over and over again of Sundays being the #1 day for reports. And when I speak to a live audience about this, I'm usually asked, well, is this Saturday night spilling into a Sunday? No, I mean, generally the reports that I was looking at were coming in on Sunday afternoon, Sunday evening. And when you ask victims or perpetrators or the people who work with them about why that might be the case, Many of them describe this scenario where, Sunday was the only day they were all together. The adults weren't working, the kids weren't in school. It's the one day of the week where they're all together. Perpetrators describe being stressed about going back to work. Alcohol often involved. And I can remember one perpetrator talking about how the children were going crazy. They'd been in the house all weekend, and because the weather had been bad, and they were just going crazy, and I just couldn't handle it. And so it's an important point to make, in my opinion, when we again think about what's going on right now. Essentially, for many of these families, during our lockdown procedures, we created a week full of Sundays, or a month of Sundays, if you will. Essentially, just Sunday after Sunday after Sunday, where everyone is trapped in the home together. Stress is high, often likely alcohol involved, and everyone just kind of trapped in this environment of just a continual Sunday. I think it's an important thing to think about as we think not only and reflect on what's happened here recently, but as we look ahead to future planning if future events do occur. It's just important to know that, and again, as a reminder, there's nothing safe about being trapped with an abuser. And again, I understand the need to take these actions to slow the spread of the virus, but unfortunately, we have dramatically increased risk of family violence by doing so. And unfortunately, in many communities, and in mine in particular, it felt like mental health and family violence and vulnerable families weren't even at the table when these decisions were being made. So my hope is that by talking about these things, we're not just trying to raise awareness and talk about some sad things that happened and heartbreaking things that happened, but how can we not let this happen next time? How can we better take into account these families and better ensure they essentially aren't just left on their own to try to figure it out? And we'll check in with you in a few months and see how things turned out. Here's a sample family violence timeline that I put together just based on again, my analysis from my prior studies. One of the studies I analyzed 9,355 police reports of and observations from the scene of domestic violence incidents. So looking at a large volume of cases there and just trying to develop a kind of a timeline. Interestingly, what I noted was that most commonly victims experienced 10 incidents of violence before they called 911. So when we often think about being, it feels like we're behind the 8 ball from the start with these families, that may speak to that. Before there was even a single police report of domestic violence, there had already been 10 incidents that occurred in the home. Unfortunately, when we see perpetrators, or we do see perpetrators using animal abuse or threats to children to delay that call. So in this particular case, where we might have normally seen the 911 call come around here, again in the area of incident 10, there's a kind of dramatic delay, and we don't see it come till farther down here. In this particular case, when you see anything in yellow, it indicates that a pet or child is involved. Unfortunately, in this scenario, the sexual assault right here resulted in an unplanned pregnancy, which is why you see that punch to the stomach there. We do hear domestic violence victims describe perpetrators kind of shifting the way that they inflict harm or violence once finding out that the victim is pregnant. Obviously, particularly if it's an unwanted pregnancy. I've heard victims describe, it was then that he started punching me in my head and my stomach. Again, just heartbreaking to think about. But again, we would normally see that call come in here at the 10th incident on average. But then we sometimes observe this critical delay, where perpetrators may use threats of harm to animals or children in the home to kind of further their control in the home and keep that victim from calling. We know that literature indicates that when a victim seeks shelter, they're at the highest risk, and they're also at extreme risk, obviously, in this critical period of delay as well. Everyone in the home is. And one of the things I'd like to point out too about given our current circumstances, I've talked with a number of victims who have indicated that I had my escape plan ready. I was ready to go. I was finally going to get out. I had everything in place, and then all of a sudden these lockdown orders came and I couldn't go anywhere. And essentially now my escape plan is either canceled or happening in slow motion. So we think about the high risk for victims when they seek shelter. How much higher is that risk right now, where their plan is just kind of hanging out there in the air, and it's just waiting to be discovered by the perpetrator. So again, risk is high for a number of reasons, but I think that's something important to think about too. This idea that of these slow motion escape plans that are kind of happening now. I mentioned the trend in domestic violence reports where initially we saw some increase, then we saw some come down during lockdown, and now we're starting to see a rise again. When we talk about child abuse and neglect, first it's important to think about where reports typically come from. So this comes from the Child Maltreatment Summary of Key Findings report, and you see the majority of report sources there. And who's often reporting. Unfortunately, when we think about these things, we think about many of these agencies now have no access to children, that they were out of this, they might have had virtual meetings, but out of, physical schools for much of this year and now for the summer. And we think of other circumstances, such as victims possibly being afraid to go to the hospital, not knowing if they could contract the virus by going in, or not even knowing for sure that they'd be seen, for a while there when we weren't sure that the hospitals could handle the strain of cases they were likely to see. We know social services, a lot of them were suspended or continue to be so, that there was a lot of issues with legal systems too, in terms of delays and court times and cases, and in some areas of the country, the inability to file protective orders and things like that. So again, when we think about all of the typical report sources of child abuse and neglect, it's not really surprising to see the reports of child abuse drop pretty significantly in many communities. Some communities reporting as much as a 30 to 40% drop in reports of child abuse. Again, in other circumstances, we might celebrate if we thought that that was a result of some sort of new initiative that just dramatically dropped child abuse. Unfortunately, in this case, we're afraid that it's not an accurate reflection of incidents, but more likely the reality that detection is so difficult right now, because most of our reporters have been separated from children. The lack of child abuse reports does not extend to the ER. Unfortunately, what we're seeing is that children, who in some cases are being abused to the point where they must be admitted to the hospital, or in other cases where they actually are fatally injured. We actually are seeing an increase in those cases. So while our standard child abuse cases are down, many communities are reporting an increase in ER visits for injury that is consistent with non-accidental inflicted trauma. Or child abuse fatalities, unfortunately. So we are seeing several communities reporting this dramatic increase. So again, the fear is that, abuse is occurring in the home, and while there normally might be this progression of violence, we're not getting that right now, because severity is rapidly increasing without anyone really, or any of our normal detection opportunities there. Things are just rapidly deteriorating, severity rapidly increasing to the point where the child unfortunately is hospitalized or is fatally injured. Another important thing to think about, and this is just one example of a Indiana county, and sometimes we see this vary back and forth, but in some years I think it's just pretty striking and important to think about. The number of substantiated child abuse and neglect reports, we know a huge number of these come from schools, and look at that jump. Once children have been out of the school system for a couple months and they return in August, there's a dramatic increase. And so again, given the current circumstances, normally we're looking at a June-July break into August. Children have not really been in school, many of them, since as early as March or April. And so we're that my concern and fear is, child welfare agencies are about to be inundated with cases, as well as domestic violence shelters. That once children are able to be seen again and are being seen, and it's just the truth, but a heartbreaking way to think about it. But the ones who weren't at the point where they were beaten and had to go to the hospital or were killed, those who were, just beaten a little less than that and weren't taken to medical care, will then hopefully at least be discovered at that point. Again, my fear though is that many of these kids, we may never find out or even know fully what occurred. But again, just the importance of being vigilant and aware that increase in cases may very well occur, and ensuring now is the time to be working our communities to and again it's just everything's in such limbo of not even knowing what we're going to be able to do or what's going to be allowed or even open. But thinking about summer camps, libraries, anyone who might have opportunity to see these children before they return to school, if they do in August. We've got to figure out a way to get to these kids earlier. We can't just wait till August and hope they survive until then. In this particular month and year, that was 685 reports per day during August, and again, that was before all of these things. That was just in a year, but before this occurred. But again, just a huge number of cases being reported each day when the children returned. As I said, with schools and some of those other things being closed, and again, not knowing how the summer will look, but churches, summer camps, libraries, sports, if they're occurring in your community, now is the time to be reaching out to these agencies, making sure they're aware that, we really, and these partnerships we form now as a result of this should continue. This shouldn't be just something that we're starting now because we're in crisis, but something that we continue long after, because many of these relationships and partnerships should have already been in place. But making sure that these agencies are aware that even more so than normal, we are dependent upon them, that if they see something or have a concern, please report it to us. That may be our best chance, at being made aware of the violence and abuse that these children are experiencing. The clock is ticking, as I said. Just the reality of just thinking about that, and the idea that our child abuse reports are down, but our fatalities and severe abuse may be up in many communities, and it's just a scary thought that essentially it's just a running clock until the child reaches that point, and that's when we'll find out. We have to find ways to reach them sooner. Additional concerns, I talked about gun sales earlier, nearly record-breaking sales, when this all started in March. So we know that a lot of guns out there, and we know that domestic violence in particular, a pretty significant increase in homicide risk, just knowing that there's a gun in the home. Unfortunately, we are, as I talked about, child deaths. We're also seeing domestic violence-related deaths. Thinking of a community that has already reported that they had more. They had 10 victims killed in just the three or 3.5 months of their lockdown than they did in the entire year of 2019. They had 10 killed during lockdown and 8 killed all of last year. And just the chilling words from the sheriff in that community, who said, our fear and concern is that there's still bodies out there that we just haven't found yet. And we are seeing reports of this increase in domestic violence-related homicide in many communities, unfortunately. We also know that officers share that risk. As you see, an officer, unfortunately, that was killed in my city of Indianapolis while responding to a domestic dispute during the lockdown. Again, it's just so important to note when we talk about this high risk and high stress, things that were already there and were already risk factors now have likely been compounded given the current societal circumstances. Though, as we've talked about, really, we haven't really experienced anything quite like this to even be able to prepare for anything like this in terms of how best to reach these families or what to do. It just really felt like we weren't ready for this. But there does exist at least some form of precedent for intervention design that would have been helpful to have in place before this, but certainly should be in place, in case this happens again. And I'm finding this precedent in natural disasters. As I've looked through different things and explored the research and literature, I think natural disasters hold our best opportunity to gain some insight into what we may be able to expect in the coming months, and also to help us better prepare next time around. When we think about natural disasters, and not just in the U.S. but around the world, we often see many of these things reported there. So the idea of increasing controlling behaviors and aggression, key organizations are closed. We see unemployment, resources suddenly go away, very high levels of stress. We see limited social support systems. All that sound familiar? It's exactly what's going on now. And family violence. It's hard to find a study about a natural disaster, to be honest, around the globe, that doesn't report an increase in family violence. And I'll admit, as someone who studies family violence and speaks on it, I've missed that. That hadn't really registered until I got into this work, how significant it is. But it's usually a pretty significant increase, and that occurs in nearly every natural disaster. this increase in domestic violence. So again, when we think about potential precedent for intervention design, I'm actually writing a study now on this topic. So eventually I'll have more information that I could share if you have interest. But I do think there's some potential there for looking at some of these prior studies and getting back into this literature and seeing what we can come up with in terms of a viable action for the future. When we think about family violence, after the crisis, again, looking at natural disasters too as a way to kind of pull in for this, the unfortunate thing is we talked about family violence increasing and all the risk related to post-natural disaster society. This disaster is so different because it's essentially a disaster in slow motion, where when you think of a normal disaster, true, it may destroy buildings and things like that we're not necessarily seeing with this crisis, although we are seeing people lose their home and lose their jobs, and places of employment and businesses shut down. This disaster is stretched out for months. So I'm extremely concerned that, as concerning as the information is regarding post society, our society post natural disaster, it's extremely concerning, and I'll touch on it a little bit, but I'll get into it more again with that paper in a future webinar I'm developing. I think it could be even worse with what we're dealing with now, just because of the prolonged nature of the disaster. After natural disasters, it's not uncommon to see the increase in shelter service and increase in reports coming in, lasting for up to 1 year after the incident. So when things do return to normal, whatever that looks like again, and whenever that is, I would think that family violence victim serving agencies need to be prepared for an increase in reports, and that increase is going to be extended. Funding and resources must be in place. Because we have not seen the worst of this in terms of resources, needed. In many ways, we may not have even really started. My fear is when things, quote unquote, return to normal, that everyone else will go back to life as normal, and then all of a sudden our work as family violence professionals is just beginning, because now we're going to have this flood of cases that is likely going to extend for a prolonged period of time. Another one of the key things from those natural disaster studies regards mental health, which was an increase in suicidal ideation and depression, anxiety, stress. It actually increased for up to 3 years after event. So again, we're looking at some concerning trends occurring now that are, without an extremely effective intervention plan, are going to continue and be here for quite a while. So again, as family violence professionals, we need to be ready for this extended period of an increase potentially in cases. The cases surely have happened, and so in a way, we're hopeful that we do receive those reports so that there is opportunity to intervene, as opposed to it just continuing to occur in a vicious cycle that obviously is likely to result in a very poor or negative outcome. Children, again, my fear is they're getting lost in the shuffle. It'll just be harder and harder to detect these types of things. Even when we think about if we see children out and they're wearing a mask, and the way perpetrators abuse and harm individuals, it's getting harder and harder to detect. And my fear is that we can't allow these children to get lost in the shuffle. Churches, other community agencies, libraries, when they can see kids again, they have to be ready, know what to look for, and know who to call. Another concern is that, again, we won't get reports from incidents that occurred, because like we see in natural disasters, the victim blames the disaster for what occurred. Well, he doesn't normally act like that. It was just high stress, or unfortunately we even hear responders or other agencies say something similar in reports from after disasters. Well, it was just related to the stress from the disaster. That's not how he normally acts. I'm sure it'll get better, and so believing that things will get better. But unfortunately, new normals have been created for a lot of these families, and it will be much easier to return to that. And that is my fear, that even months or a year from now, we'll start to see this cycle pick back up. And so again, that's why I really believe this is going to be a prolonged increase in cases that we're going to be seeing for quite some time. The other discouraging difference in not that there's really any positives in either form of disaster or what we're talking about here, but after a natural disaster, it can sometimes unify a community, where communities kind of band together. They want to work together to rebuild and things like that. This is kind of the opposite. We've been kind of all sent to our separate corners. We've all been separated very much. There's a feeling with across the country and really everywhere, as we've all isolated and self-quarantined. of this, really the opposite of, we're very much divided. And so that's concerning to me too. This idea of division and isolation and all of these things that may, again, that perpetrators prey off of, and it may allow them to further exacerbate the effects of the violence that's occurred in the home. I do want to add too, we talk about stress and risk factors for the unemployed. The employed also, I think we need to be remembering those who were clarified or who are classified as I hate the way that it's worded. It implies that not everyone is essential, or but they were worded by most governments to be declared essential staff and employees. I probably would have come up with like a grouping name or some other system, because I don't necessarily like the way that's worded. But thinking about who was employed during lockdown, when we think about medical providers, first responders, likely under a great deal of stress. And so they too, unfortunately, are at risk for committing these types of acts in the home. The picture there is from a study that looked at it reminds me, or I put it here to remind me of, a study that looked at the Australian bushfire natural disasters, and reported an increase in incidents of domestic violence perpetrated by responders after witnessing just horrific incidents, watching animals killed, watching friends or coworkers killed, and just related stress, and the partners of these first responders coming forward as part of the study to describe the increasing abuse in their home. So I just put it there to say, we think about the risk factors I described earlier. It's also important to remember there's high risk being felt by those who are working and who are working in uncertain and likely very difficult conditions. Now more than ever, we must be proactive in forming new partnerships. As I said, many of our more common report sources don't have access to these families, or have restricted access or limited access. It's time to be thinking outside the box. And again, as we form new partners, these are not just partnerships that last during the pandemic, but that extend after. Many of them we already should have been working with prior to. Specifically, I'm referring to postal workers, heating and air or home repair, garbage collectors, grocery pickup, food service, food delivery. All of these agencies, even in lockdown, are still out in communities and still have opportunity to detect abuse. In fact, many of these individuals may already have homes or families they're concerned about. So if you don't have partnerships with them, it sure makes sense now to form those, to make sure that they understand, hey, right now detection is difficult, but you guys may be in an opportunity or have an opportunity to detect while other of us can't, and make sure they know how to report and what to do. In the middle there I have Mr. Hudgers, obviously, but just this idea or concept of being a good neighbor. Historically, we see family violence most commonly reported, again, by the report sources I shared earlier for child abuse. Domestic violence is usually the victim calling, and we don't often see very high numbers of reports from neighbors. Some estimates have it around 8% of DV reports come from a neighbor. So we don't typically see neighbors reporting domestic violence. I'm thinking of just a horrific incident that occurred during lockdown, where a victim described where the perpetrator grabbed her by the neck. She had a young daughter who grabbed the perpetrator's arm, and the victim thought that probably scared the perpetrator to see that little hand on his arm. He released his hold. She said, I just ran to try to break out a window and just scream for help, but none came, and he ended up suffocating her with a pillow. When she came back to, she was able to get away and escape. But just this, you think of the horrific incident, knowing your child's there and screaming for help in their neighborhood, and nothing happening. And so I just encouraging individuals to be a good neighbor now and always, to be vigilant. If you see something, here's what you should do, here's how you should report it, and please do that. When we talk about kind of creative or ways to more effectively intervene, particularly when we have our hands tied behind our backs as we do now. When we think about family violence and domestic violence in particular, we often focus on the adult, but we forget about the two other key players that, again, we want to focus on to help them, but also remember that by bringing in all of these pieces, we bring additional agencies to the table and further and expand our reach. So we know that in homes where domestic violence occurs, as much as 80% of them have one or more pets, and 60% of them have at least one child. So we very often see children and pets in homes where DV occurs. And we know that you really can't separate the well-being of one from the other. Adults are often very dependent on the pet. Perpetrators often use children or pets, threats of harm to them, to affect the adult. Children are extremely dependent on their caregiver, and the pet plays a critical role for all. And so it's important to note that we cannot separate the well-being of these three. And again, I note the adult can be a male. It can be a male or a female. I view these three as a team, and we have to help them all, in my opinion, if we want to help any of them. So we have to remember that by bringing all of these pieces to the table, we are also adding additional opportunities for detection, which we're going to get into next. Again, we don't often hear pets talked about as much when we talk about family violence. But think about the things pets provide. They provide protection, comfort, friendship, a sense of purpose, acceptance, stability. They're hope. They provide hope or are light in the darkness, and entertainment and laughter. Think about how critical these components are, to emotional health and well-being. Now think about how much more so they are for victims of domestic violence who may be isolated, who may have, when we think of children who may be abused in the home, they may have difficulties at school. Their pet may be their only chance at feeling all of these emotions. They are so critical to these families, and unfortunately I believe that's why they're often targeted by perpetrators, because of what they provide to the victims in these homes. In a single word, pets are family. Over 90%, I think it's actually closer to 97% of Americans consider the pet to be part of the family. I don't know what was wrong with the other 3% if they didn't understand the question, or they need a do-over, but pets, in my opinion, and in most Americans' opinions, are absolutely a part of the family. And again, as I said, when we bring in pets and we think of them as part of the family and realize their impact and role in these homes, again, it's worth it just to protect the pet, but then also thinking about opportunities to protect humans in the home as well. It kind of opens up new doors. When we think about animal control officers and veterinarians, we think about how COVID-19 has affected the human side. This side may not have been as much affected. When we think about, at least in my community, the beauty salons and barbershops and things like that were all shut down, but pet grooming places were allowed to remain open. So again, there was still opportunity there potentially for contact with these families, whether it be through dropping off an animal or when we think about vets seeing animals and knowing, what types of injuries are concerning for non-accidental trauma, there still remained opportunities there that may not have been there for other agencies. The idea of animal welfare and human welfare working together is not novel. It's not new. It's actually a return to our roots. Again, for time's sake, I'm not going to spend a lot on this. You can look it up in the ASPCA or through other online resources. But the idea is essentially animal or child welfare efforts around the globe, and especially in America, were actually birthed from animal welfare efforts. The Society for the Prevention of Cruelty to Animals, started by Henry Bergh there in 1866, and later a partnership with Etta Wheeler, who had concerns regarding a child named Mary Ellen regarding severe abuse and neglect, and reached out to him for guidance. And then later it resulted in the start of the New York Society for the Prevention of Cruelty to Children. So again, we saw animal welfare leading to child welfare. Somehow over time our paths have separated and we don't work together as well anymore, but we should. Again, this is not new. This is a return to where we started. And now more than ever, I think it's critical that we look at renewing and revisiting this partnership and trying to further it in our community. Some of the information I like to share that again, I think just speaks to the importance of those combining animal welfare and child welfare. Here's a scatter plot. I do a lot of mapping in my research and work and do a lot of spatial analysis. But we look at domestic violence reports in Indianapolis over a single year. This is just a sampling. There's more than that, but these were police calls. On average, I think it's closer to around almost 4,000 police calls a year now for domestic violence. So that's just a sampling there. But again, these may or may not be coming in right now. But animal incidents are more likely to continue to be reported. Data is less in terms of what's out there right now and how the lockdown is affecting animal welfare and animal abuse reports, but there's reason to believe that it may not be affecting it too much, and we'll get into that here in a little bit. So while we may not have those reports on the left, we likely still have those reports on the right. And given the considerable spatial overlap, it's a resource you should be exploring. So if we're not getting DV calls, the phone stops ringing. Is our animal welfare call still ringing? And are we responding to incidents with individuals who know to be looking for harm to humans as well? Given the overlap, if you're responding to an animal incident, you must be looking to see if humans in the home are safe as well. You know, it may be our best opportunity to get into some homes right now. And again, you see another map that's in a different county in Indiana. There's domestic violence over a single year police reports. Here's animal control reports over the same year. Again, we may not be getting those DV calls, but we may still be getting the animal calls. It's just an important reminder of the need to have animal control agencies. I know in Indiana, I think it's 30-something% of our counties don't even have animal control, so they wouldn't even have a map like this. But if you do have it, it's something that might be important and helpful to utilize. Again, just to at least, as we're thinking about just the overwhelming nature of what's going on, and we know violence can occur anywhere, but even identifying some of our higher targeted areas in our community that may be an additional need of resources. Again, I have some people say, well, you're targeting areas of the community, it's unfair. That's not at all what's going on here. We're identifying areas of the community that are likely in need of resources, and many times providing those resources can eliminate abuse or reduce its occurrence or likelihood of occurrence. So again, targeting areas that may benefit from additional resources can be extremely helpful. And finally, another county I'll share, Boone County in Indiana. You see DV on the left, and then there's animal control the same year on the right. So again, you know, on this, it's just, I think it speaks to the importance of utilizing animal control, animal welfare data if you have it, particularly when we lose access, as we may be now, to some of the domestic violence type reports. One of the key differences that I've alluded to earlier, again, when we think of child abuse and domestic violence, more commonly calls come from outside agencies. If you're a child abuse victim, a child abuse report, normally schools, law enforcement, medical providers, social service providers. If it's domestic violence, it usually comes from the victim themselves most of the time, 70 to 80% of the time. Animal abuse and welfare reports, as much as 80% of the time, come from a neighbor or passerby. So the complete opposite. While neighbors only report 8% of domestic violence calls to police, they report 80% of animal welfare calls. So again, it speaks to the importance of utilizing data if you have it, but also forming these partnerships, because what an important breakthrough and insight potentially into homes where human or abuse of humans is occurring as well. If neighbors are more willing to report animal abuse, using that information and knowing the shared risk for humans there as well, again, is a whole new ballgame when we think about reporting of abuse of humans, and thinking about better utilizing those information sources. Now, again, we want to promote for neighbors to report about abuse to humans as well, but we at least know they are reporting about animals. So it's, again, we sometimes in this field, as you know, we kind of have to work with what we've got. We often operate with very limited resources, and they're even further limited now. So it's just something to keep in mind that neighbors do report animal abuse, and so it's something to think about, especially now as they're more likely to be in the home. There might be greater opportunity to see and detect and report. It's also important to note these cases of animal abuse. Again, we're concerned for the animal. We want to protect the animal as well. But it indicates an increased risk for individuals in the home if domestic violence is occurring too. So if, and there often is an overlap there, if animal abuse is occurring, if a domestic violence perpetrator also harms animals, that risk in the home for humans truly spikes. And this is another one of my studies, and I measured a whole range of characteristics, and each one was statistically significantly increased just by knowing the perpetrator abused animals. But the one I'll share today is this idea that the victim lives with a daily fear the suspect will kill them. 35% of the time, just in a home impacted by domestic violence or IPV, that number jumps to 78% if the suspect harms animals or abuses them. So again, when a domestic violence perpetrator also harms animals, we must pay attention. We're concerned by all domestic violence cases, but when they harm animals, we really, really need to pay attention. They're much more likely to have a gun. They're more likely to have mental illness or abuse substances. They're much more likely to have attempted or threatened suicide. And suspects are much more likely to live with daily fear they will be killed in the home. We also want to know about animal abuse because of what it means for children who reside in that home. It can't be overstated the importance of protecting that child-pet bond in these homes. Unfortunately, as you see the mechanism there, we often see animal abuse being kind of a key turning point. So when animal abuse starts occurring in the home, children, for a number of reasons, all of them heartbreaking, may begin to engage in animal abuse themselves. And when children, and we're learning of children who report, or we're hearing reports of children who are abusing animals, we must pay attention. Because beyond those animals, they, without effective intervention, they're much more likely to go on and commit abuse against humans in the home, community, or in their school. And so again, when we know a child is committing an act of animal abuse, we need to pay attention and we need to intervene. We need to look backwards and think about, well, have they been abused or harmed themselves? Why are they committing this act? And then we also need to think forwards and how can we, what we're preventing by effectively engaging and intervening at that time. Because again, as I said, this violence may begin in the home, but it will spill out into the community. And we do see to the extreme level, many serial killers, mass shooters, and other acts of mass violence, the perpetrators having this history of abusing animals and or victimization themselves as a child. Again, it doesn't mean that everyone who abuses an animal goes on to become a serial killer, fortunately, but many serial killers do have that history. We say desperate times call for innovation is the way I like to put that. Desperate measures doesn't really sound too reassuring to others. So some ideas, and I'm working on more. Again, as I said, I'm working on another webinar to build off of this one that we'll be putting together later. I don't know if it's one I'll be able to share with you or not, but I hope to be able to get it to you. I noted that during all of this that hotels were donating free rooms for medical workers. What a great opportunity to do the same for victims of domestic violence. And I have noted there are some communities where motels have stepped up and done that. Unfortunately, there are other communities where the shelters have had to do that. And the result is that they have essentially exhausted their budget because it's extremely expensive, to put victims, much more expensive to put victims in hotel rooms, than it is in the shelter scenario. Many of these hotels just sat empty. I feel like it would have made a lot of sense. We obviously would have had to include security. We would have had to protect, to figure out a way to anonymize where victims are sent. Obviously, safety is paramount. But the idea of being able to separate them, particularly if they tested positive or there were concerns they might test positive for COVID-19 in their own isolated hotel room, there are a lot of options there that I think we should have really done better with, that I hope we can do better with next time, because I think that would have been very helpful for many shelters who were running out of space, who were having to turn people away. I know in Ireland there was a partnership with Airbnb where they offered free shelter to DV victims who needed it. And again, these are essentially satellite homes, so they're spread all over the place. It's easier to keep them anonymous when there's no set central location, but just spreading rooms in different hotels and different locations around the community. I heard from an agency in Indianapolis, and I've heard from a couple others, the idea of putting some sort of sticker or indicator on your mailbox that might alert a postal worker, that there is abuse occurring in the home, or that you're afraid. Offenders may still be allowing victims to go get the mail, and if it's if we can figure out a way to alert victims without necessarily making it such an obvious sticker that a perpetrator is going to notice it, it might provide a good opportunity for these victims who are too afraid or unable to call to be able to alert us. And then also we've seen the YMCA in some communities, and I know of in particular, there was one community in Indiana where the YMCA was allowing victims to text them. And I think that's important to think about too, having texting options when things like this occur. And there are some of those things already in place, but making sure that victims are aware of it. That it might be dangerous to speak out loud. And often it's dangerous to text too, unfortunately, because these perpetrators may often check phones and things like that. But even if it's a system where an emoji text, I heard one group talk about, could alert if something going on in something occurring in the home. So again, it's time to get creative. We need to be thinking about this now. If this continues and for whenever the next event such as this occurs. Another thing I think we need to think about is what we're declaring as essential in our organizations. And in my local community, again, I was very disappointed. It felt like mental health, family services really took a back seat while alcohol continued to flow freely. There was no interruption in alcohol service in our community. Liquor stores remained open. They were essentially declared essential, while mental health services were closing and options were decreased and diminished. Liquor stores remained open. And one of the things I most commonly heard was this idea that if liquor stores were closed, and I'm not saying this is the reason why, I haven't heard this officially, it's just what I've heard from others. If the liquor stores were closed, there would just be this overburdening of ERs of individuals suffering alcohol withdrawal. And I don't know what basis there is for that. And I know, interestingly, there were a few countries in Africa who actually did ban alcohol sales, or at least severely limit them throughout the lockdown. They gave opportunity and warned they were doing it. So if individuals wanted to purchase alcohol, they had a week to do so. I think it'll be interesting. I would assume studies will come out of that. I haven't seen or heard any yet, but I hope that they do. I don't know. Like I said, I understand our actions to prevent the spread of the virus, our need to protect hospitals. We don't want them to be overburdened. But it often felt like, to me, in many of the decisions that were made, family violence, mental health was just not even at the table. And we just so significantly put these victims at risk by our actions. I just wish more was done in their column, that there was more that remained for them. And my hope in sharing this message and in talking about these things is that there will be in the future. I don't want to just raise awareness, but rather create change. And so if you have ideas, if you have information that you can provide as we've talked today, about these issues, please send them to me. I always look for new partnerships. None of the presentations or information I'm providing related to COVID-19 I'm charging anything for. I don't feel right charging off anything related to this, considering how the times are. So if there's ways that I can find the time to help you or your organization, please reach out to me, and I will absolutely try to do so. Again, as I said, I grew up with this idea that my life was of no account. I can remember people saying, well, what do you want to be when you grow up? What do you want to do? And I would often say, it doesn't matter. I didn't care. I just thought, my life was a sacrifice. I was going to give things up to protect those I loved and cared about, and my own life didn't really matter. And that dog there taught me otherwise. And years later, as I suffered from alcohol abuse and just terribly, terribly dark depression, and just wanting my life to be over, I remembered the lessons he taught me and the things I learned from him, and it really made all the difference in the world. And one of the lies I believed was that I could never be a good father. If I didn't have a blueprint, how could I be a good father? And nothing could be further from the truth. As I hold my precious daughter there, I'm a father of 3 now, and man, my kids are the world to me. I love them so much, and I'm so glad I did not believe that lie that I couldn't be a good dad. The things we've talked about today, the circumstances are stacked against us, but what's new? In the field of family violence, we're always fighting an uphill battle. How much more so are the victims we fight for, though? You talk about a worthwhile fight. These kids are so worth it. They're facing and their parents and their pets and these families, they're facing odds far greater than the ones we face in trying to serve them. And it's my firm belief that we owe it to them to push through, to find ways to innovate and find ways to reach them. We can't just wait and hope things turn out well. We have to find ways to get to them and help them. Here's a sampling of some references. I rarely give a talk where I don't use at least 100 references. I think for today's talk, we're at about 180 books and academic references that I used. You'll just see a few of them flash up here. And then here's my contact information. I post a lot of information on Twitter and Facebook, obviously mindful of risk, and I protect anonymity, or make sure to anonymize information so I'm not putting anyone at risk. I've already published 5 times just this year alone. So by emailing me, I can get you some of those publications as they come out. I shared the one that was out. There's another out, another that's I think supposed to come out this week, and I just submitted one an hour ago, and actually am now in progress of working on a book that kind of has a working title, Pets Are Family, where we'll get more into the pet issue for that book. So if you have interest in any of those things, please contact me. I'm glad to answer any questions, and any way I can help your important work in this area, I would love to. So again, thanks for your time, and I appreciate your attention today. Thank you.